allow me to present to you a brief medical report of the late Honorable General Elly Tumwine Hiriwe on behalf of the medical doctors led by Dr. M. Jackson, who is a senior consultant and director of the Uganda Cancer Institute. We do have a couple of doctors that were involved in the care of Honorable General Elly Tumwine. From the Uganda Cancer Institute, I was the lead doctor who looked after him. My name is Omoding Revels, I'm a consultant oncologist at the Cancer Institute. Together with Dr. Kookie, who is not here, others are Dr. Solomon Chibude, who is a radiation oncologist, Dr. Lutu Israel, a senior consultant radiation oncologist, Dr. Leta Joseph, who is a medical officer, is right on my left, Isaac Muliowa, who was the oncology nurse, who time and again, together with me, looked after Honorable General Elly Tumwine. We also want to recognize also the efforts from Mulago Specialized Women and Neonatal Hospital, where General was admitted before he was transferred to Nairobi. We also had input from the Uganda Heart Institute from Dr. Manino John, senior consultant cardiothoracic surgeon. We also had a team from Mulago under the leadership of Dr. Rosemary Bianyima, especially the gastrointestinal surgeons who came in to help with the care of Honorable Elly Tumwine. As well as so to recognize the input of colleagues from Nairobi Hospital, Professor Godfrey Nsereko Lule, and Professor Tieno Abinya, who finally were at the tail end of the care of Honorable General Elly Tumwine. How and when did we begin to meet with Honorable? We first had our encounter as late 2020, just before the lockdown. And that's when we had our initial consult with him. Honorable Elly Tumwine was then 67, 66 years of age, and presented to us with very three cardinal symptoms. One was cough, the other one was chest pain, and wheezing. These were very classical symptoms of a lung problem. We went ahead to investigate him. We had what we call a PET scan, which is an investigative tool to determine if you have any active cells anywhere in your body that might actually be reminiscent of a cancer process. That had actually revealed him to have a left-sided lung mass, as well as swollen glands in the middle of his chest, and it had actually already spread to involve his backbone as well. We had quite a back and forth conversation with Honorable General Elly Tumwine on whether we should actually do a biopsy as a gold standard in cancer care. A biopsy is key to determine the actual enemy we are fighting. Those were the words we actually used to talk to him about. It was a back and forth conversation until sometime in June of 2021. It was almost 6 months after our interface with him that we eventually had a biopsy done at the Cancer Institute. We were able to confirm beyond reasonable doubt that we were dealing with a form of lung cancer, an adenocarcinoma, which is quite a common form of cancer in our current setting. Over 80 to 90% of the people who are non-smokers can actually develop this kind of cancer, compared to the other type that is common in people who are smokers. We then embarked on therapy. We were able to initiate Honorable on treatment. We began him on what is called targeted therapy, because now we know that all cancer types are treated very differently, and particularly the type that he had quite a good benefit on what we call targeted therapy, which was a simple medication that we actually provided to Honorable. He took this medication for an entire 1 year. From June 2021, he did very well. He went back home, he went back to his usual routine. And we used to come and check him here at home, and we came up with what he called village therapy as a form of treatment as well, out of the city. And we were all very happy and very glad. Honorable was doing very well. It was until towards late of June 2022 that he actually called us and told us that he wasn't feeling well. At this particular time, Honorable had complained of, progressive back pain and weakness of his lower limbs. We were very quick to actually have a quick imaging to evaluate whether we were dealing with progressive disease or not. We did a couple of scans, and all seemed like stable disease, bearing in mind that we were already dealing with very advanced lung cancer because of his bone involvement. We then had a tumor discussion with the Cancer Institute, and we agreed that we provide him with additional form of treatment to regulate the particular areas on his spine that had been involved by disease. He went ahead and successfully completed the treatment with quite very remarkable improvement. His pains all receded, his weak limbs became a little stronger, and we're quite very happy that all seemed to be progressing well. It was until late July of this year, 2022, that I received a call from him again. And this time around, he had developed some complications with passage of urine. And when we re-evaluated him, we now found out that I think we were dealing with progressive disease. Sooner before we could do anything, he developed bowel complications as well, as a result of complications on his nerve supplies to his bowel. We were quick to have him admitted, and we had to discuss, and we agreed in principle that we change his treatment to an immunotherapy form of therapy, given that he was quite very weak and frail. He couldn't tolerate chemotherapy. We began him on that treatment, but down the road, Honorable continued to deteriorate, and we had him hospitalized. In the course of hospitalization, now the challenge was complications with his bowel movements. We called on the GI surgeons to come on board to help with the bowel complications, but we couldn't do much at that point of time. He developed more fluid accumulation in his abdomen and also in his lungs, despite our effort to provide immunotherapy. Following that, discussions were made to have him airlifted to Nairobi. He was received by Professor Nsereko Lule at Nairobi Hospital. They attempted to do as much as they could, but a couple of days, 2 days after his arrival in Nairobi, he developed what we call sepsis infection, kidney failure, and on the early morning of the 25th of August, he got the cardiac arrest and he could not be revived. That was the tough bit. We lost the battle to lung cancer, but as a team that has cared for Honorable, we learned a very important lesson from him. He was a very, very patriotic man. It took us a great effort to convince Honorable even to go out of Uganda. He believed in us. He believed in Uganda that he had fought for, that he had liberated. And he told me, Omoding, when I saw your team, you must treat me in my country. His words were very heart-moving and very challenging to us. In our entire medical career, we have not seen such a senior citizen who was not willing to travel out of his country to go out for treatment. We will miss Honorable Elly Tumwine. He's a patriot. He was a very knowledgeable man as well. he shocked many of us, even in the medical field. He was widely read. We want to thank the government, His Excellency the President. On behalf of our medical team, we also want to thank the family. I want to thank the UPDF, Directorate of Medical Services, and we want to thank God Almighty for a life well lived of Honorable Elly Tumwine. God bless you all.